And welcome everyone to another Smart Money Circle episode. I'm Adam Sarhan. With me today is Brent Lucas, who's CEO of Envoy Medical. Ticker symbol is COCH. Brent, thank you so much for taking the time and welcome to the Smart Money Circle.
Yeah, thanks for having me. Really excited to be here.
So, Brent, I always like to begin. Can you please tell us your story and how you got to where you are today?
Sure. My story with Envoy Medical actually goes back to when my parents first invested in the company back in 1995 in what was then called St. Croix Medical. So I've been around the company in one form or another for going on 29 years now. As I progressed through law school, I actually started working for the company in 2007 as an intern, marketing intern, then sort of kind of legal intern. Became general counsel after I passed the bar. Really didn't want to be a lawyer. Kind of knew right away that, law school was a means to an end, but I didn't want to be a lawyer. Passed the bar, became general counsel, and then moved into sort of business development or marketing roles as I went through time at Envoy. Really wanted to get an understanding of, who are our customers and why our product is not selling the way that I thought it should be. So got in the field really to understand things, and really enjoyed that quite a bit. Over time, then became more and more involved in the company and eventually became CEO in 2015 when we pivoted from our first product, the Esteem, to our Acclaim product, which we're very excited about, our breakthrough device, which is a fully implanted cochlear implant. And have been in the CEO role since then and was the CEO who led us to go public through a SPAC in 2023.
Wonderful. I love the story, love the law school, the CEO story. That's going to resonate with a lot of folks. And I'd like to ask you about your company. Please tell us what Envoy Medical does and all your competitive advantages.
Sure. So Envoy Medical is the only company on a major U.S. exchange right now that is a hearing implant company. So Envoy Medical specializes in hearing implants, but also hearing implants that are fully implanted. So we are unlike anything else that's currently on the market in that regard. But we also have this very unique twist, even from our international competitors, in that we use the ear to pick up sound. So our big competitive advantage is that we have a sensor that sits on the incus bone, which is part of your hearing anatomy. And that actually picks up the sound versus a microphone. Like you and I right now are talking through microphones, but the human brain really learned to hear through the ear, these big floppy things on the side of our head. And we use that, we leverage that, which is really the beauty of Envoy Medical's technology, in that we have a fully implanted device, but also one that uses the ear to pick up sound, not a microphone. Some of our competitors, international competitors, they actually put a subdermal microphone behind the ear, or they have one of these. And I kind of brought this, I don't know if you can see it, but this is a traditional cochlear implant. So this is what you might see today. You'd see somebody sitting around looking like this. Well, we've taken all of that and put it internally. So now I could have one. You might see a little bump back here, but you wouldn't see anything else. And that's really what separates Envoy Medical from every other company on the planet right now.
Wow, I love that. So basically, you've taken the hearing aid and implanting it inside and then letting it do its thing without having a big clunky thing on the outside. Is that correct?
Almost correct. So it's not a hearing aid. That what I showed you there is a cochlear implant. So a cochlear implant has those big bulky externals.
Yeah,
Uh,
what's the difference, please?
sure. So a cochlear implant is for people who are profoundly deaf. So these are people who no longer could benefit from a hearing aid. These individuals need some electrical stimulation in their cochlea. So we have taken everything on the outside here. So this has a battery, it has a microphone, has a sound processor. We've taken all of that off the side of your head and put it internally. Um, a hearing aid is for people who have more of a moderate level of hearing loss. Those people can still benefit from hearing aids, and we think, hearing aids are great technologies for those people, and we're actually not interested in competing with hearing aids. What we want to do is we want to disrupt the hearing implant business, which is a
Got
class 3 medical device. And there's a company, Cochlear Limited, right now, an Australian company, has about a $16 billion market cap in Australian dollars. We're looking at taking, a good part of their market share. That's our goal in life right now is to disrupt the cochlear implant market. We think it's ripe for disruption, and we think there's a highly underpenetrated market there. Just to give you some numbers for that, a cochlear implant could be used in the United States alone for adults. A cochlear implant could be used in about 2.8 to 4 million US adults. But right now, less than 5% of those people get a cochlear implant.
Oh, wow.
Our thesis on that is essentially that it comes down to people don't want to wear those big bulky things on the side of their head. Plus, they want a device that is more conducive to their lifestyle that they can wear to bed. They can wear if they wear a helmet, if you go on a bike ride and you wear a helmet, or you're a hockey player and you want to wear a hockey helmet, you can't do that when you have a big thing on the side of your head. So we've really built a device that we believe will be better for patients from a day-to-day perspective.
Got it. Now makes perfect sense. Thank you for that clarification because that's important.
Right, right.
So, okay, let's shift the conversation a little bit, Brent. Talk about some timeless advice. This is my favorite part of the show. How do you handle risk, and what are some mistakes you see people make with respect to risk management? I'm interested from your law background, from your business expertise, anywhere you want to go.
So I think from a risk perspective, there's a couple of things. I mean, first of all, we want to build, at Envoy Medical, we're a startup company, right? I know it's a 30-year-old startup company, but some people build startup companies to flip them or to have them bought or acquired by a larger company. I think that's a mistake, and I really think that exposes you to making some very silly mistakes that you're hoping somebody else will fix later. And so as we look through the risk management process of building a very, a class 3 medical device is a highly regulated device. And so one of the ways we've gone forward is to say, okay, we're going to be the ones that are stuck with these decisions for the lifetime of our careers and the lifetime of the device. And when you really own it in that way, I think that helps set you on a path that makes the most sense for the company and for the product.
Yeah.
The other thing that we've done is we don't put too much power or control in the executive management team. Executive management team, like myself, is there to lead the organization, set overall strategy, but we really need to rely on everybody top to bottom in the organization. So everybody at Envoy is a family member, a team member that we really instill to own the product, to own their part of the business. And I think that's helped us really move where we don't just have people sort of punching a clock, but people that are here to build the business for the future. And I think those are very, very, very helpful ways.
Got it. Thank you for that. How about some timeless lessons that you've learned that you'd like to share with the audience?
Well, there's been a lot of lessons learned. Obviously, as a company that's gone through some ups and downs over the years, I think, some of the things that we've learned over time is to really listen to our customers. If you look back at Envoy's history, one of the things that our advisors told us very early on in this process was, you have an amazing sensor technology. Take that sensor technology and put it with a cochlear implant, and you can change the world. You can disrupt the market. Had we done that in the early aughts, for example, we would be probably a wildly successful business right now. But we sort of delayed ourselves 10 or 15 years. I still think we're going to get there. But instead of getting there in 2027, 2028, when we get FDA approval for this product, perhaps we could have gotten it 10, 15 years earlier. And I think some of the folks that were involved in the company back then got a little distracted by sort of delusions of grandeur. And what they should have done is really listen to the overall market and the advisors that were saying, look, you have this wonderful thing here, but take it and put it with a cochlear implant, because a cochlear implant's covered by insurance. Cochlear implant's an accepted technology. Then later go back and try your middle ear implant, which is what we did. We kind of did it out of order. But
Right.
if we had listened to our advisors, I think we would have made a lot of headway. I would also say, related to that, that there's certain realities in your industry. One of the realities in the medical device world is you need reimbursement. I know it sounds obvious and
Right.
ridiculous, but you need reimbursement for a medical device to really take off. And we sort of had our head in the sand in the early aughts again, and through FDA approval, our first product. that we did not put enough time, money, and energy into that. We put too much time into how are we going to market this? What is our, commercials going to look like? What is our direct to consumer advertising going to look like? What we should have done is really, build the foundation that we could have built upon. And I think that was some mistakes that we learned along the way.
By the way, I love the honesty, love the objectivity too. The fact that you can go back and see those mistakes clearly sets you up for a very clear path of prosperity going forward because a lot of people get stuck in their ways and they hunker down and double down. I didn't do anything wrong, and the ego takes over and all that kind of fun stuff. So I find that a very, very admirable trait and successful trait for CEOs to have. So my hat's off to you. I'm not wearing a hat, but hats off to you.
Yeah. Well, thank you there.
Um,
I spent a lot of time reading Greek tragedies in high school, so I understand that hubris is a very bad thing. So I try not to have any of it.
It's a killer. It really is. All right, let's talk about the next thing, Brent, for you. Leadership. Let's talk about what makes a great leader and some lessons you've learned about leadership that you'd like to share with the audience.
Sure. I think one of the things that folks really sort of grab onto is leadership that is willing to do the work, to put in the time, that is transparent and honest. So I know the leaders that I like to follow, and my mentors that I've really, I have some great board members that I've been able to learn from, like Glenn Taylor, who's a billionaire here in Minnesota, is our largest shareholder, a big supporter of the business. I've been able to learn a great deal from him. And one of the things that he does so very well is he listens to everybody around him. He takes things in. He doesn't try to control a conversation. He really allows people to talk, and then he contributes. Even though he could, if he wanted to, control a conversation, he really allows people to bring the conversation to him so that we all can be part of it. Chuck Brynelson's our current chairman. Spent a lot of time in medical device. He's somebody else. He really listens to the people around him. He has his opinions, but he invites those from others to come in because maybe he's wrong about something and maybe we need to learn from it. So I think leadership, the skills that I've really seen benefit an organization are those people who are willing to listen, those people who are really willing to take in the advice of others and not sort of impart their will. On the other side of it, I have seen some folks, have been around some folks that really do just sort of force their narrative on a particular thing, like the reimbursement thing I talked about earlier. Oh, we don't need reimbursement. We're going to be cash pay only. That was a huge mistake. And if we had listened to people around us, we would have really understood that it was a mistake and changed our ways many, many years ago. So I think that would be my key, is to really just listen, take in opinions from those around you, and not get sort of stuck on one idea.
I love that. How about adversity? How do you handle adversity, and what are some obstacles you had to come along the way, and how do you deal with them?
So unfortunately, I've had to learn quite a bit about adversity. Going back to high school, I used to be, I joke about this with my kids today. I was on a football team that was horrific. And so we would constantly lose by multiple touchdowns every game. And you kind of learn a way to deal with that in a way that's not personal, right? So you start to build a mindset of, I have to get better every day, even though, this game didn't go well or this season didn't go well. How do I get better as an individual? And then you can start to pick up your teammates and really help them see, the forest and ignore the trees, or, try to win the war, not the battle, all those kind of adages, right? So I think from an or an adversity standpoint, Envoy Medical is a 29-year-old company. And if you look at our history, there are plenty of times along the way where we could have given up, and some people would have. But because we continue to move forward, we really are now in a much stronger position than anybody would have thought that we would be in. We are now on the verge of disrupting three much larger cochlear implant companies with a fully implanted cochlear implant. I mean, we're the first people to enter a pivotal clinical trial in the United States with this technology. We're still the only ones that have a piezoelectric sensor versus a subdermal microphone. So we've really honed our skills and our knowledge. And had we not learned to go through that, those moments of adversity, sort of, just brushing it off and understanding, we're going to be stronger as a result. Had we not done that, we'd be in a much worse situation. So I would say what I've learned from adversity is to take it on the chin and go through it and keep going.
I love it. I love it. So, let's talk about the best piece of advice you'd like to give the audience or your 30-year-old self.
My 30-year-old self, let's see. I think it would be so that was a period of time where things looked a little bleak in the Envoy thing. I think what I would have told myself, and this was a period of time when I wasn't really quite sure what we were going to do. And I would just say, just, listen to your gut and keep going. That would have been my biggest piece of advice, to myself. And I think to the audience, you really just do need to believe in yourself and continue forward.
Love it. Well, Brent, thank you so much for taking the time to speak with me today. Hopefully, we'll have you on again soon. Congrats with the success, and I'm excited to see where you're going to be in the near future.
I appreciate it. Thank you very much.
Thank you.